Welcome once again to American Christian or Christian American. We're going to be talking about healthcare today, and we're going to be talking about the involvement of racism in healthcare. Surprise, surprise. Racism has affected just about every part of this country. One of the documents I'm going to talk about just a little bit, it's an old document. It's called Bleeding the Patient. It was a book written about our healthcare system and the amount of deaths and everything it related. And also, you can get this if you look at Bleeding the Patient book, and if you look at the names and authors on there. All right. So there's some statistics. It's been a while since I read it, but I remember a few statistics I'm going to quote from there. It's old data and things, but it's still relevant, and I think it'd be great for you to check it out. Now, what we're going to be talking about, we have a clip here talking about the connection of racism and the healthcare system. And then I'm going to expand upon it because I have actually had experience in working with a Universal Healthcare Action Network in the state of Minnesota, and I know some of the facts, so we can talk about that. Let's get into this clip though. Oh, before I get into that, be sure to push the subscribe button and push the like button, because all these things are going to help this channel to grow. And I am still learning. I've come away since I started. We're in video 28 compared to video 1. So hopefully you'll push those buttons and give me some more support, and tell your friends about this so we can continue to spread the word.
Yes, for you guys today, talk about healthcare. It's Thom Hartmann. He's the host of the Thom Hartmann program. That's on Sirius XM. It's on radio stations across the country. It's on Free Speech TV. But he's also a New York Times bestselling author. And his new book is called The Hidden History of American Healthcare. Tom, welcome back to the show, brother.
Hey, Cenk, it's great to be here with you, and it's so nice to see you again.
It's great to see you, man. All right, so Tom, let's talk history as we often do. Most of the developed nations have single-payer health care, so what that means is public health insurance, right? Now, some go beyond that, the UK does, et cetera, but we don't. Why did we diverge from everyone else? How did that happen?
It really began in the 1880s, 1890s, when medicine became a thing. And there was this guy named Frederick Ludwig Hoffmann who came over here from Germany. And he was a young man. He was 17, in fact, when he came over, and was a numbers genius. And he hooked up with the Prudential Life Insurance Company, ended up being a vice president. And he was the guy who figured out that there was an association, a statistical association between working in a cotton mill and having lung problems, asbestos and mesothelioma, smoking and lung cancer. He published on that in the 1910s, in the 1890s and 1910s, and diet and cancer. In fact, his book on the association between a high processed food diet and cancer is still in print. He's been dead since 1946, but his book is still around. So he's really smart in these things. And so he married this Southern belle from Georgia who was from a racist plantation family. And so he ran the numbers on black people and found that black people were dying, dropping like flies, more likely to be sick, more likely to die of pretty much everything. And concluded, which was the general consensus at the time among a lot of white people in the South, this is again in the 1890s, that black people were genetically inferior. And in 1896, he published a book called Race, Tendencies, and Traits of the American Negro, in which he lays out all the numbers, and then he concludes that if we simply avoided allowing black people to have any access to health care, that within 2 or 3 generations, the whole race would die out, and that would solve the race problem in America. Now, it sounds kind of crazy when I just lay it out like that right now, but this led to a whole bunch of things. By the 1920s, this was referred to as scientific racism. He was testifying about it before Congress. When Teddy Roosevelt, 1912, proposed a national health care system, people said no because black people will get it. When Franklin Roosevelt proposed a national health care system, it was the same thing. We don't want black people to get it. When Truman tried it in 1947, same thing. Don't want black people to get it. Right up until 1965, Senator Stennis, the Dixiecrats in the South, was quoting Hoffman who was like, by then dead, but is still very famous in this field, as saying this, we have to figure out a way to keep black people from using Medicare. This is when they were passing Medicare. And the way that they came up with was to have a 20% hole, a gap in Medicare, so that you had to pay 20% of your doctor's bill and your hospital bill. And that would discourage poor black people from showing up at the hospitals. I mean, it was the most shocking thing I discovered, Cenk, when I was doing the research on this book, is that nearly 100% of the reason why the United States is the only country in the world that doesn't define healthcare as a right and doesn't have any sort of national healthcare system to speak of is because of racism.
That's amazing. I love when you find hidden histories.
And that's why you've got 12 states that still haven't expanded Medicaid, right? Free health insurance for low-income people, all former slave states.
So we're going to talk about single-payer healthcare, all right? First of all, we have this video talking about the history. The main reason from the beginning is why we don't have universal healthcare in the United States is because white people in power didn't want black people to have it. They wanted them to just die off. It was their reason to kill off black people was to deny them health care. In the meantime, many poor white Americans also suffer. So you see, they don't care about you if you're white and poor. You're just a casualty of war. They will let you die just as well. Now, even though this has been the main reason we don't have universal health care, it's not the only reason. Especially in the last 30 or 40 years, there has been massive wealth gain by the richest people in this country through healthcare. Insurance companies make billions of dollars on treating you, or not treating you, actually, as much as possible. Between the insurance companies and the drug companies, they rip American people off so they can have as much money as possible. Don't believe the lies that have been put out there by the GOP and others that healthcare is socialism and all these other things. Healthcare should be a human right in this country. But again, one of the big causes for not wanting universal healthcare is because they don't want black people or non-white people to have healthcare. I'm going to break this down for you. I have some time in working with Universal Healthcare Action Network. So I'm going to talk about some few things. We're going to start with the basics. Let's just take a single-payer healthcare system. By the way, when Bernie Sanders and others talk about Medicare for all, that is a single-payer healthcare system. It's just the name that was chosen. And if you want to understand where the term Medicare came from, it came from Canada. That's what their system's called. We adopted their name, only we didn't really make it what they do. We limited it to 80% and only for those who are seniors. And again, the 80%, that 20% would discourage African Americans from going to the doctor and perhaps get sick and die off. So, what do they do? What is the premise of them? The idea is that you and I cannot afford to go to the doctor on our own. Okay, if you're middle class, you might be able to afford to pay for a doctor's visit. You might be able to afford to pay for something like that, or go to the dentist with some struggle. You might be able to afford for some prescriptions. But the more you get into it, the less we can afford. We cannot afford to pay for a major surgery or anything like that. Most people can't. So the idea of both a single-payer healthcare system and insurance is that we can't afford it. So by pooling our money together in a larger pool, you are actually putting your money there to pay for somebody else's health care when they're sick. And then when you get sick, the pool pays for you. Now, the larger the pool, the more cost savings there are, because there's more people to spread across the costs of when somebody gets sick. Larger insurance companies have more advantage over smaller insurance companies because they have more people in them. A single payer healthcare system would have all people in it, and so the cost for the sick people will be spread out much farther. All right, so that's the basics of it. Now, what is the goal of a single payer healthcare system, and what is the goal of insurance companies? The goal of a single payer healthcare system is to pay for the cost of healthcare for American citizens if we had it. The goal of an insurance company has nothing to do with taking care of the American people. It has to do with making a profit. They do so by denying you as much as possible. Now, the GOP would like to say that it eliminates your choice. Well, if you're talking about choosing an insurance company, yes, it would. There would only be one choice. But if the system is set up to take care of your health care instead of making a profit, that's not the most important choice. And it's really not the most important choice anyway. What is the most important choice? You get to choose what doctor you go to. In an insurance company, they give you a network of doctors that are part of their network that you can go to. If you choose to go out of network, you may pay more costs. You may have more deductibles, or it may not even be covered. Under a single payer system, every single physician in the country is in network, as long as they're licensed. Now, they might be restricted to the state they work in, depending what their license is, but every single physician in the country is in network. And so, therefore, you can go to any physician. And you can go to any dentist if we set it up with dental care, or vision care. You can go to any vision outfit if we set it up with vision care, as well as prescriptions too. You can go to any place to get your prescription if it's part of the single payer network. Now, different countries do it in different ways. For instance, Canada, their system is much better than ours, but it doesn't include everything. Canadians have not had dental included. However, there is movement there to provide dental for the poorest of Canadians. So otherwise, you have to buy dental insurance on your own. They don't cover prescription drugs. However, they negotiate the prices down, so they pay much, much less for us for their prescription drugs than we do. The system that is trying to be brought to this country would include all medically necessary items, as well as dental and prescription drugs, long-term care, nursing home care, or in the home. Now, there could be some copays with dental. There could be some copays on prescription drugs. Bernie Sanders suggested that the max would be $250 per year out of pocket per person. So that would be the max that you would ever pay in a calendar year, and prescription drugs can cost a great deal. As far as anything else, like regular doctors and stuff, there would be no more copays. You would not have to pay a copay when you go to the doctor. It would be covered. You would not pay any copays when you go to a hospital. That would be covered. If you had to take an ambulance, that would be covered. Now, there might be restrictions in there if a person is abusing the system by taking an ambulance when not necessary. I don't know about that. But either way, the cost will be much cheaper. Right now, people can pay $700, $800 or more for health insurance to cover themselves. And it is greatly disparate between income. You may make a small amount of income, but your health insurance would be a huge cost. It's not only bad for the employee, it's bad for the employer as well. Under a single payer system, it would be a percentage. Some of the percentage that have been discussed is about 12%. Now, we don't know exactly where the ratio will be. Is it going to be 50-50, meaning the employer pays 6% and the employee pays 6%? It could be the employer pays 8% and you pay 4%. Either way, we'll go with 6 and 6 right now. So for every dollar that you earn, 6 cents would go towards the healthcare system. If you have $100 you've earned, you'll pay $6. If you get $1,000, you'll pay $60. And if you earn $4,000 in a month, you would pay $240. And of course, I don't have the math in my head. If you made $1 million, you pay more. And that's how the system is paid for. The more money you make, the percentage might not go up, but the more money you make, the more you would contribute to the healthcare system. Single-payer healthcare systems have between 2 and 3% administrative costs. One of the examples we have that is Medicare. That's what they have. Where private health insurance has between 12 to 20% administrative cost. A single-payer system is from birth to death. So, if you go on strike, this is where it helps. One way it helps unions. If you go on strike, you're still covered. You don't have to worry about losing your insurance. So you can fight for your wages. You'll still be covered with health care. Another thing that helps unions is because of the fact you don't have to negotiate it anymore. The company has to pay that. You negotiate your wages, you can focus on those things and other things. If the wage goes up, then your contribution to healthcare goes up, but it's still going to be whatever percentage is decided upon. Even if we went to 14%, it would still be cheaper than what we do now. For example, for me, being in union, I have to pay all these co-pays. I also have to pay in towards a state-run pension healthcare system. I wouldn't have to pay any of that. I would just pay the percentage that I pay, and when I go to the doctor, it would be absolutely free. My prescriptions would be cheaper. An example, one of the things I'll call from billing the patient. These figures are old, to give you an idea. You compare this to a Canadian hospital compared to an American hospital. The average hospital in the United States at the time that book was published, several years ago, was 50 people in the billing department. And the average in a Canadian hospital, there are 2. Wow, what's the difference? The 50 people have to deal with all the different insurance plans, when they're denied, when, trying to get them to go through, and all this different stuff. In a single-payer healthcare system, like Canada, everything medically necessary is covered. Why are they there? Well, people coming from other countries, especially the United States, they have to bill those people. So you imagine how much money just there you can save on not paying people to do those jobs, but you can pay people to do other jobs like a doctor or a nurse. Another way we help the single-payer system is to cover our education. So doctors don't, even if they could make a little bit less on a single-payer system, they wouldn't have medical debt. They wouldn't have any of that, because if their education was covered, that's over $200,000 they wouldn't have to pay. They would get their income. No bankruptcy. You wouldn't have to worry about going bankrupt because you have all this medical debt. You will also wouldn't have to worry about losing your home if your parent goes into a nursing home, because the system would pay for it. You could save money on your car insurance. Really? Yeah. Your car insurance would no longer have to cover if you or somebody else is injured in an accident. The system would pay for that. So car insurance would no longer have to cover that. Also, it would be better for big business or smaller businesses, because they no longer have to pay disproportionate cost for health care. They simply pay the percentage of what their employees make. If they decide to pay their employee $25 an hour, and then the price is 12%, and it's divided either 6 or 8% of the company, that's a limit they're going to have to pay. I drove a bus in Minnesota for 19 years before I moved to where I am now, and my paycheck back then, we're talking about 15 years ago, I was bringing home about $1,200 every 2 weeks. Now, I was only a single coverage, but if I had been in the family coverage, the coverage for insurance was $1,400 a month. Employees were paying $400. Singles were free. But look at that. More than, if you have a family, more than half of your monthly income went towards it. If that was a single payer system and it was, you were paying 6% or your employer was paying 6%, whatever, even if you're paying the full 12, think about the cost savings. If the employer was paying the full 12, think about the cost savings to the employer. You wouldn't have to worry about that anymore. You could retire when you want to if it's the only thing you're concerned about is health care, because you'd have it. Your choice of doctor, pools. Okay, so everything else, another thing is the doctor would be able to treat you without interference from the insurance companies. Under a single payer system, the doctor is the one who should know what you need. If you need a surgery, then the doctor can give you that surgery. Now, it's always still smart for you to get a second opinion, but as far as insurance denying it, it's not going to happen. If it's a medically approved procedure and they can document that you have a problem, it's going to be approved. Now, if you have an ugly nose, it's not going to pay for that. It's not going to pay for anything that is cosmetic. But if you're in a car accident and your nose gets shifted around, moved around, or dislocated or taken off, it's going to pay to restore your looks. Now, if you were born with the nose upside down, there's a possibility of drowning to death in the shower or in the rain. A little sarcasm. It would pay for a birth defect to bring you back to what people should normally look like, or something that's dangerous to you. But it just wouldn't pay for cosmetic reasons. If you don't like your nose, you're going to have to save some money and go to a plastic surgeon to do that. But everything medically necessary. You go into a nursing home, they're going to pay for that. You need home care, it's going to pay for that. And it's going to do it cheaper. You don't have CEOs making millions and millions of dollars. Again, over 15 years ago in Minnesota, United Healthcare is based in Minnesota. At least it was then, I think it still is. And the CEO, William McGuire, was making over $107 million to run the company. Besides, he had around $700 in unexercised stock options. Look at all that money being paid to a man to sit back and he doesn't treat anybody. Under your universal system, you may have some people who are in charge. They may make $300,000 or $400,000 a year, while everybody else makes a good income, perhaps $80,000 to $100,000 a year. But you're not going to have people making multi-millions of dollars a year to run healthcare. Healthcare should be a human right. These are the things that we should cover through taxes. People say, well, I don't like the government involved. The government would not be involved any more than Social Security. Social Security pays out to cover people, and it's been very successful. If you make laws, it's going to take care of it. You can trust the government if they make laws more than you can trust an insurance company who cares nothing about you at all. Now, granted, there's always a problem with repealing it, but with the government, we have a choice of electing people who will make those decisions. Now, that doesn't mean they have to be in your business. You still have privacy and patient confidentiality, but you don't have to worry about whether you get sick or not, whether you're going to be covered. A single-payer system would help Americans in this country do much better, and it would bring a lot of us out of poverty. It's not going to help us alone, but it is a big step. Remember, the reason you don't have it is because people were racist and cared nothing about African Americans in this country. And they didn't care about the poor whites either, because they would throw them aside to get rid of the African Americans. Stop believing all this garbage. Start understanding that you've been cheated and you've been screwed by people who don't care about other human beings. We need to stand together so we can have universal health care in this country. It is a human right. And in many other industrialized nations, and it should be here. The cost would not go up, the cost would go down. The only people who are going to really hurt are the insurance companies who are richer than any of us. They may not have as much money. And it could hurt some of our politicians who get their pockets lined by the insurance companies to stand against single-payer health care. Do you really care about that? I know I don't. I want politicians who work for the job, get paid as a politician, and don't get money slipped under the table to screw you and me. And these people are not Christians. When they do that kind of stuff, I don't care what they say. They're not Christian. A Christian doesn't do that to other people. A Christian has compassion and cares about other people. And they don't line their pockets by sacrificing people. Until the next time, an American Christian or Christian American.